A month plus of horrible air in Delhi and the national capital region. Now, Grab stage 3 curbs have been revoked because of slight improvement in the air quality in this region. With this, the 50% work from home system mandated for offices has been discontinued. Hybrid mode of classes being followed by schools has also been revoked. The Commission for Air Quality Management, CAQM, the Central Pollution Control Watchdog, has already tightened emergency pollution control measures by revising the graded action plan just a few days ago. But the fact of the matter right now is that doctors in unison are saying that, listen, this isn't just about a problem in the winter months. And also, this isn't just about asthma or some breathing difficulty during this time. Every organ, every cell is getting affected. Also, cases of lung cancer are increasing in Delhi in the younger population. I'm being joined right now by Urvashi Prasad. She's worked in the area of public health. She's young, and just a few years ago, Urvashi was also diagnosed with stage 4 lung cancer at the... Urvashi, I want to ask you, when you were diagnosed with lung cancer, you have told that you never really smoked. So what happened here? What did the doctors tell you?
Yeah, I was always a very fit person and with a very healthy lifestyle, and also did not have any symptoms as such until they came on pretty suddenly,
Right.
and actually they were all related to my liver, not to the lung, because by then the cancer had spread. So after an initial sort of misdiagnosis, when all the tests were done and the confirmatory genetic tests were also done, that is when they
Yes.
diagnosed me with stage 4 ALK positive lung cancer.
As far as your case is concerned, you're obviously linking it to air pollution. Your doctors have done the same.
That's right. Cancer is always, you can say there can be different factors, but air pollution in this particular case has been identified as a very, very important trigger.
Urvashi, you've also worked extensively in the area of public health. Tell us a little about what your thoughts are as far as the current situation is concerned.
Yeah, that might be in the short term, but in the longer term, which is of course different for all of us, it could be 1 year, 2 years, 5 years, or 10 years. Every organ in the body is certainly being affected in some way or the other, whether it is causing early onset dementia in people, or raising blood sugar levels, or triggering arthritis, or then of course cancers of various kinds. It might not happen immediately, and that is why people often don't see it as a problem which is that important. But surely all of us are being fed this poison, and it might be a slow poison, but we're all taking it in, and it will have consequences, if not today, then down the line at some point.
Dr. Arvind Kumar, chairperson of the Institute of Chest Surgery, Medanta, is now joining us. Thank you for your time. Talk to us about the profile of lung cancer patients and how that really has changed in Delhi over the last few years, sir.
So 30 years back, 90% of the patients were smokers. They were men, and they were in their 50s and 60s. So it was known as a disease of elderly smoker men.
Okay.
And when I look at my current data, I find a smoker, non-smoker difference to be 50-50, which means half of my patients today are so-called non-smokers. I find the men-women ratio also to be about 60-40, which means as opposed to rarely women, today 40% of the patients are women. It's a huge demographic change, which I have observed in a short span of 30 years.
And the direct link, doctor, is air pollution.
I attribute it conclusively because if you look at the composition of the cigarette smoke and you look at the composition of the polluted air, you find that the cancer-causing agents are common to both.
What would your word of caution really be? And what would be your word of advice to those people who feel A, that air pollution is a seasonal problem, happens only in winters, which again is not true, and also that it's going to be causing some inconvenience, but never really affect every cell and every organ of the body. What do you have to tell those people, sir?
Neha, this is all myth. Air pollution is a serious health crisis facing most of the country. Almost 98% of the surface area is affected. To say that it is a Delhi centric or North centric problem is wrong. To say that it is only October, November, December months problem is wrong. We have it across the year. Only thing is, in these 3 months, the optical quality of the air goes so bad that it
Yes.
becomes visible to all, but pollution is present throughout the year.